How will the findings reported at CROI by Althoff et al. Regarding the incidence of cardiovascular, kidney disease, and cancers from the Veterans Aging Cohort Study affect the types of antiretroviral regimens recommended for patients initiating therapy?
So the Veterans Aging Study is a huge study using the Veterans Administration database, which has been going for a very long time. It's a very rich source of data, but of course uncontrolled. And so it's like a lot of other databases. It has some limitations in that you can't control for any of the variables. What it showed was that patients that had HIV infection had increased risks of cancer, end-stage renal disease, and cardiovascular disease. However, when adjusted for other risk factors, not including HIV, the risks were similar to those in age-matched controls. Now, the question was, will that change our recommendations for antiretroviral therapy? And I think the answer is no. And the reason is that there are other reasons to give everybody antiretroviral therapy who has HIV infection. So that's the broad definition. In the United States, that's the recommendation by the DHHS guidelines and the IAS USA guidelines, which are the major drivers of guidelines in the United States. And I don't see them changing on the basis of that study. Of course, there are a number of other studies that do implicate immune activation as important factors in the premature aging, premature long-term complications that are associated with HIV infection. So it's not necessarily a conclusive study from the VA, but I think that's only part of the reason it wouldn't change the guidelines. The guidelines are now partly driven by the fact that HIV treatment prevents transmission, and therefore virtually anybody with HIV infection is treated or recommended to have treatment on the basis of the public health issues associated with HIV infection. But I think many of us still are uncertain that there are not prices to pay or health consequences to the individual, even with a relatively high CD4 count, and therefore are unsatisfied that the VA study is going to be the conclusive study on that point.